seat. I'm Jason, I'll be your nurse today. If you would just have a seat on the examination table. I'm going to wash my hands. We're going to be assessing your lungs and thoracic area today. Also going to be assessing your cardiac and peripheral vascular systems and also your abdomen. Okay, so I'm going to start by assessing your lungs and thoracic area. First, I'm just going to observe your respiratory pattern, so just breathe normally for me. Okay. Next, I'm going to measure your respiratory rate for 1 full minute. So just continue to breathe normally. For time purpose, I'm going to simulate that we have measured her breath for 1 full minute. Respiratory rate is 20. Respiratory pattern is regular with no signs and symptoms of distress. I'm going to assess her lips. No bluing around the edges. Skin is normal in color. Assess her nail beds. No clubbing noted. No signs and symptoms of cyanosis. All right. Do you have any history of lung disease or lung problems?
No.
Okay. You having any excessive coughing or shortness of breath lately?
No.
All right. Next, I'm going to ask you, if you would, just to turn to your side. All right. And I am going to, don't lay back just yet. Just like that. I'm going to place my hands, if you could scoot back for me. All right. I'm going to place my hands at the base of your lungs, and I'm going to ask you to take a deep breath. We're going to assess your lung expansion for symmetry. Basically, I'm just seeing if your lungs expand equally on both sides. So let me get the base of your lungs. Go ahead and take a deep breath in and let it out. One more time, deep breath in and let it out. Lung expansion is symmetrical. Next, I'm going to assess the anterior part of your chest for any abnormalities or deformities and any tenderness, okay? Sternum noted, xiphoid process. Okay, no abnormalities or deformities noted. Was there any tenderness as I pressed over those areas?
No.
Okay, anterior, posterior, transverse chest diameter is normal with a 1:2 ratio. Now I'm going to assess the posterior part of your thoracic area and chest wall for any abnormalities or deformities or tenderness. No abnormalities or deformities noted. Was there any tenderness as I pressed over those areas? Okay. Next, I'm going to percuss using the indirect percussion method over the posterior or the back part of your thoracic area and your chest wall. Basically, I'm just going to take 2 fingers, place them against you, and tap them with 2 other fingers from either side, and listen. Findings are normal, dullness in the lower bases, overall normal findings. Next, I'm going to listen or auscultate your lung sounds anteriorly, posteriorly, and laterally. Basically, that just means I'm going to listen to your breath sounds front, back, and on the sides. So just breathe normally for me. lung sounds are clear, diminished in the bases, normal vesicular lung sounds noted, no rhonchi or crackles noted. I'm going to wash my hands, and that ends the thoracic and lung part of our assessment. Next, I'm going to assess your cardiac and peripheral vascular systems. First, I'm just going to observe your anterior or the front part of your chest for any heaves or pulsations. No heaves or pulsations noted. Do you have any history of cardiac disease or problems?
No.
Any history of peripheral vascular disease or problems?
No.
Okay. Next, I'm going to listen to your heart sounds over all 4 valvular areas using my stethoscope with both the bell and the diaphragm. Want to note that I am using a master cardiology stethoscope, that the diaphragm is used by placing the stethoscope flat, lightly against the skin, the bell by pressing more firmly. Aortic noted over the second intercostal space, slightly to the right of the sternum. Pulmonic noted in second intercostal space, slightly to the left of the sternum. Herbs noted at the third intercostal space, slightly to the left of the sternum. Tricuspid noted at the fourth intercostal space, slightly to the left of the sternum. Mitral noted at the fifth intercostal space, left of the sternum, mid-clavicular. S1 and S2 noted. No S3 or S4 gallops noted. Next, I'm going to palpate or feel your radial pulses, your post-tibial pulses, and your dorsalis pedis pulses. I'm measuring those for quality and amplitude. Radial pulses are strong. Bounding. Equal, symmetric. Post-tibial pulses are strong, bounding, symmetric. Dorsalis pedis pulses are strong, bounding, and symmetric. Rhythm is regular at the radial, post-tibial, and the dorsalis pedis. I'm going to wash my hands. And that ends the cardiac and the peripheral vascular system check of our assessment. Next, we're going to assess your abdomen. So if I could get you to lay down on the assessment table. Lift the shirt just slightly. First, I'm going to assess for any lesions. Do you have any history of abdominal surgery? Any history of abdominal pain or problems? Do you have any abdominal pain right now?
No.
Okay. No scars noted. No lesions noted. Skin's intact and within normal limits. All right. Next, I'm going to listen to your bowel sounds over all 4 quadrants using my stethoscope. bowel sounds are normal active. And while I have my stethoscope out, I'm going to back up to our cardiac assessment and listen to her apical pulse for 1 full minute. For time purposes, I'm going to simulate that I listen to the apical pulse for 1 full minute. The rate is 82 and the rhythm is regular. Now I will continue with my assessment of her abdomen. We have listened to your bowel sounds over all 4 quadrants. Now I'm going to percuss or tap, again using the indirect percussion method over all 4 quadrants. Some dullness in the left lower quadrant. Overall findings are normal. Now I'm going to palpate or press your abdomen over all 4 quadrants, assessing for tenderness and masses. No masses noted, no rebound tenderness noted, no guarding that would suggest pain. Was there any tenderness or pain as I pressed in those areas?
No.
Okay. Next, we're going to do a deep palpation underneath the right, on your right side, underneath your rib cage, just so that I can identify the inferior or the bottom part of your liver. When I do this, as I press, I'm going to ask you to take a deep breath, and I'm going to press firmly. Okay. Find the bottom of your rib cage. Take a deep breath. All right, let it out. Let's do it one more time just so I can be sure. Deep breath. Okay, let it out. Inferior border of the liver is noted. No appearance of enlarged liver or hepatomegaly. All findings seem to be normal. I'm going to wash my hands. Mrs. C, you may sit up now. That ends the abdominal assessment part of our patient, and it also ends the overall assessment of this patient. All findings are within normal limits. Overall, this is a healthy young adult female. Thank you, Mrs. C.